I am Dr. Yaşar Güntepe. I am an orthopedics and traumatology specialist. Today, I will try to enlighten you about knee and joint pain. Knee is one of the strongest and most flexible joints in the body, so its treatment must be made carefully. First, I am going to talk about the anatomy of the knee. It consists of two main bones called femur and tibia, and they are encased by patella, the kneecap, which protects the inner structure of the knee. Within the inner structure, cartilage, meniscuses, bones, and muscles makes up the joint. Of course, the bones, muscles, vessels, nerves, meniscuses, and bones that form this structure is subject to their own diseases. Furthermore, if we are to look at the risk factors, being overweight is one of the biggest factors. Unless the body weight is regulated, it will cause pain in the knees. So, nutrient and exercise, which I will talk a bit about in the future, is crucial. Previous fractures or dislocations are also a risk factor which can cause deformities that might apply excess weight to the knees. Genetic diseases or lesions of the cartilage are among other risk factors. Primary diseases are injuries, tears, or ruptures of the knee tendon, usually associated with the sportive activities or trauma-related incidents. I am going to talk about the treatment of these later. There are meniscus disorders. Rupture, sink, and injuries of meniscus are usually classified as sportive injuries as well, but it can also occur in other people as well. Even though sportive or trauma-related serious injuries are the main cause, professions that require repetitious activity, such as being a housewife, may form lesions in that area, or even inborn deformities might result in meniscus disorders. Calcification becomes a problem with advanced age. One of the most severe problems of the knee joint is calcification, which is caused by excess weight on the knee joint applied through being overweight, weak bones, or trauma. Furthermore, there are cartilage lesions. Damage to the cartilage results in cartilage injuries. Also, rheumatoid arthritis, which might be indicated as pain in other areas such as hips, ankle, and waist, might pose a serious issue. Chondromalacia patellae is a type of cartilage lesion occurring due to patella grinding against other joints, femur and tibia. This lesion is caused by going up and down the stairs, sportive activities, walking, or putting too much strain. We treat these diseases regarding the degree of the condition. We can use anti-inflammatory medication and/or painkillers at the beginning stages. These can cure mild or initial degrees of problems. There are various types of physical therapy. Also, it can be treated with numerous treatments such as ultrasound and infrared. Exercise is also an effective method. Using these exercises, we prevent excess weight being applied to the bones by shifting the weight to the muscle tissue, thus relieving the knee pain. Of course, other types of exercise like walking can also be beneficial by weight control and muscle-bone power balance. Swimming, cycling, and of course the most important, walking. Weight control is crucial in joint and knee disorders. In order to accomplish this, we must be mindful regarding our diet. If we consume foods that contain high amounts of flour and sugar, beta cells in the pancreas secrete insulin against these nutrients. Insulin secretion causes excess sugar to be stored in the liver and internal organs, especially around the stomach, inducing metabolic syndrome. The biggest impact of metabolic syndrome is gout, calcification, osteoarthritis, rheumatisms, and even though it's out of our topic, some heart diseases. Therefore, it is critical. So, we must reduce the consumption or completely cut out these three white poisons, namely flour, sugar, and salt, that is especially salt crystallized or industrialized in factories. By implementing these countermeasures, we can prevent disorders and prevent them from breaking out in the first place. Us doctors' biggest objective is to diagnose disorders before the symptoms begin and take precautions. There are many methods to treat these disorders, yet they take too much time and workforce, so watching out for metabolic syndrome and trying not to get sick is better. Exercising each day, starting out from 30 minutes and progressing up to an hour, will be beneficial. Not causing metabolic syndrome by not consuming sugary, floury foods, and being mindful with our resting activities, such as sleep, we will be able to prevent knee disorders as well as other problems. I wish everyone a good, healthy day.